Hello my dears, welcome to my channel again. So today we are going to discuss one case note. Here there is one presentation. It's like example for a referral letter. For exam you will get the question paper same like this. So there will be reading time 5 minutes and writing time 40 minutes. So in that 5 minutes you can utilize your time just to get the idea, and you can segregate the data like relevant data, semi-relevant data and irrelevant data. So in this time you could not touch your pencil or anything, so just you can read it like fast. So the first step what we can do is just read the first sentence. That is the patient, Mrs. Martha Vivek, date of birth 21/11/1941, is a 75-year-old woman who is being discharged from hospital to a rehabilitation center. So you came to know that your patient name, age, and she got admitted in her hospital, but now going to discharge to rehabilitation center. All right. Now we will go to the last sentence. This is nothing but writing task. So don't go to read from the start to end. Just start with your first sentence, then come to the last. So now we can just read the writing task. Using the information given in the case note, write a discharge letter to the nursing unit manager, the rehabilitation center, Waterford. So from this sentence, it's clear that you are going to write discharge letter, and the reader is nursing unit manager. He is working in rehabilitation center at a Waterford. And so actually in this letter everything it is clear, but in some cases this one will be confused, but later on we will see. Anyway, this letter it is actually the discharge letter, and the reader is given but the reader name is not given. And by this time in some letters you can find out the purpose of the letter, but here actually they didn't mention clearly what is the purpose. Anyway, we will go to the remaining question. So now you can read the remaining things. Marital status without, family, 2 children, son lives locally and daughter interstate, and they have given social history, lives alone. Then medications, antihypertensive, Rambritin mg. Admission date is important, 5/3/2015, and fainted getting out of bed and fell to the floor, found by son. Diagnosis, X-ray, fracture left neck of femur. Treatment, left hemi arthroplasty, that is osteotomy, hip replacement surgery, and the general anesthesia. And there is incision with drip. Postoperatively, they managed with IV fluids, blood packs, Lasix, and okay, antibiotics has given. And here you can see the pain management medications. Wound management, they did dressing, there was drains and removal, everything. And the day second, sitting out of bed. Day 3, mobilizing with a pickup frame. Day 4, uneventful. Day 5 is mobilizing short distance with pickup frame. Day 6, uneventful. Discharge plan is preparing for discharge today. Day 7th, actually that is the day of discharge, and now you have to think about something else, because here in this question this is somewhat tricky. That means you can see day 7 it's a discharge to the rehabilitation center. Discharge medications are Ambril 5 mg daily, paracetamol whenever is needed, and hospital transport arranged. Day 8, repeat checkup for hemoglobin, monitor BP, BID for 3 days in a week. Then day 10, assess for rehab therapy, inpatient and not return home. Removal of remaining staples, wound can remain exposed afterwards. So in this question, actually it's like unclear when we are writing letter. Anyway, just remember always on the day of discharge. So mostly all the letter will be on the day of discharge from the facility. That's the discharge day. So here you can see that discharge plan, it's the day 7 is the one when we are writing the letter. So until then all the things it's happened in the past, and the remaining things have day 7, day 8 and until day 10, this is the plan. So here you have to mention, or you have to put underline, or you have to put the star or tick mark or something which indicate the recommendation. So just now during the 5-minute reading time, just you concentrate on wherever the plans are there, recommendations are there, and what is the exact thing is happened there. So something like you can just get the tip from the reading part. Now, after 5 minutes of preparation time, now we can start to write something in the question paper. So here, so what is the first thing you have to do is just you have to underline something or put the tick mark or the star as I told you before. So better you can do it the tick mark or the star for the relevant and semi-relevant data, and you can underline the things for the recommendation, because in this question paper it is clear that from the day of 7 to 10 this is the recommendation, so there is nothing to be worried regarding the recommendation paragraph. But most of the question paper, sometime it will be here in I mean the this plan, I mean the recommendation plan. Some plan will be there in the management, some will be in the under the plan, something will be there in the I mean in the middle, at the end, at the top. So it will be like it's not in an arranged manner, so you will get confusion. So always when you read the case note, just put underline, just keep the underline in recommendation paragraph and put the tick mark or star in the relevant, semi-relevant data, and you can put the X mark on the relevant data if you need. It's not mandatory actually. And in this case I can tell you, you can just put tick mark in I mean for the patient name and age. Patient will be discharging to the rehabilitation center there, and the marital status without, leaves alone, that is the social history. Then antihypertensive drug, Rambril, admission days is needed, and fainted, getting out of bed, that's when needed. Diagnosis X-ray, fracture, that one needed. Left hemiarthroplasty, that one also needed. Then post-operative management, you have to tick mark. Intravenous therapy, blood transfusion, antibiotic, and analgesics, that's enough. And wood management, daily dressing, and mobilizing with the pickup frame. That's all. And in the discharge plan, you can underline discharge medication, Rambril 5 mg, hospital, that one no need. Sorry. Repeat check of hemoglobin and blood pressure, assess for rehabilitation therapy, and removal of remaining staples. So these are, it will comes under the recommendation paragraph. So now just you can plan for the later. Actually here the scenario is patient brought by the son after fell down in the home, and when they came to the hospital, when they came 5/3/2015, then they did x-ray. In that the diagnosis, they diagnosed that is a fracture. Then the patient undergone left hemiarthroplasty, and they managed with everything. These all management. Now with the assistance the patient can mobilize, but still she need someone's help until the recovery, complete recovery, until at least day 10 she needs somebody's help. That's why they are shifting the patient to rehabilitation center. So here from this we can understand that this is a this patient needs continued care, ongoing care, or follow-up care. So anyone, and these three is same: ongoing care, continued care, and follow-up care. Everything it is same. So that is the purpose. Actually, that is in the purpose, I mean introduction paragraph. You can make use these things. Then yeah, now you can just thinking about the sentence construction. So first one, there is a date. You can write mostly the date of exam. I mean that is the thing will come. And the next things and all when I will show the model answer paper, I will explain you. And regarding the purpose, now you got the idea that the patient, we are referring the patient to the rehabilitation center who has undergone surgery. That is the main important thing. The patient now actually underwent the surgery for the rehabilitative purpose. We are sending the patient to the center. So the main purpose is that the patient require continued care, and the discharge status is today. Today is the date they are going to discharge the patient. And in the body paragraph, you can just mention when the patient came and with what she came and what is the investigation done and what is the surgical management, medical management, and pharmacological management. And regarding the physical therapy, physical activity, how she is doing. This much it will come in the body paragraph. And in the social paragraph, you can see here family, that is a widowed, and she's staying alone. and she likes gardening. Then she's regarding the medical history, she's hypertensive and is on treatment, and that's all. And the recommendation paragraph, it is clear from the date 7 to 10 what all the things is mentioned. You have to write it there. So I hope it's clear. Your writing task is clear. This is a simple question actually. It is nothing to be confused more. So let us see how to write the. Here I am presenting one example for this letter. So what we discussed, the question paper. So this is what I wrote in a paper, like an answer. So here, let us see with the date. So according to the question paper, I wrote the date. Okay, so it's 11 March 2015, and the reader is the nursing unit manager, the rehabilitation center, Waterfall. So here, one thing you have to mention, I mean, I have to keep it in your mind. If there is name given, you can write Miss, Mrs, Mr, something like that. And in the second, I mean, in the address, there is no need to write the nursing unit manager. So if there is no name given, you have to write the nursing unit manager, or else there is no need. You can just write the reader name, and down you can write nursing unit manager. So here there is no name given. So I mentioned is like the nursing unit manager, the rehabilitation center, Waterfall. And the next one is a salutation, dear nurse, because there is no name given. If there is name given, you can write dear. Dear you can write, and Miss or Mrs, but you have to write the surname. Then the down regarding Mrs Martha Vivek, this is the patient name, comma, aged 75. Next we will move to the purpose. So this is the important paragraph. So this is like discharge letter, same like transfer, more or less same, the same format. You can start writing like this. I am writing to refer Mrs Martha Vivek, who has undergone left hemiarthroplasty surgery. She requires continued care. She is said to be discharged into your care today. So these three sentences should be there in the purpose paragraph or introduction paragraph. So I hope it's clear. I am writing to refer regarding the patient name. Full name should be here, and who has undergone the recent present medical history. Who has undergone left hemiarthroplasty surgery, or else you can write who underwent left hemiarthroplasty surgery. Here another one more thing you have to keep it in your mind. Once if you write the spelling like capital letter, if it is left hemiarthroplasty surgery, completely you can write small letter. Or else if you want to write is like a caps lock, L should be caps lock, hemiarthroplasty, that H should be caps lock, and surgery, S should be caps lock. So better you can write everything is like a small letter. Next one is the requirement, that is a continued care. You can write continued care, ongoing care, or follow-up care. Then the discharge status, she is said to be discharged into your care today. So it's clear. Next one is the body paragraph. So you have to write it here. How the patient got admitted in the hospital, what are the investigation done, and how they diagnosed the case, and how they managed. So can be surgical management, can be medical management, as well as nursing management. And at the end you can just sum up with conclusion, little conclusion. If it is needed, you can just conclude with a simple sentence. So let us see here. Mrs. Vivek was admitted on 5 March 2015 following a fall at home. So here you have to here I want to inform you one thing. If you write was admitted, it's okay, but if you want to write presented, there is no was or has or nothing. So you can write Mrs. Vivek was admitted on. So if you want to write the patient came to the hospital, just not admission, it's like a clinic or something, means it's like it will come like presented. So you have to write Mrs. Vivek presented on 5 March 2015. So admitted means you have to write was. So Mrs. Vivek was admitted on 5. The format of date should be like this. Okay, the date, March, and the year, there is no comma. Following a fall, and here you have to think about the following and followed by. So it's like a confused words. It's like if you want to tell something, two things are happened. Here the patient fell down and admitted in the hospital. So which one which one happened first. So she fell down, that is the first one. Second one is that got admitted in the hospital. So if you want to write it's like a opposite way, you have to use following. That means admitted first we wrote, then we have to write following, then what happened in the first, that is the fall. And if you want to write like a continuation, so first patient got fell down and got admitted, like that means you have to put the followed by, so in the center. But always when you are writing in the OET letter, so this is the following, this is the one mainly you have to use. So according to this paragraph, this is correct with the following. Her X-ray examination showed fracture in left neck of femur, so related to the investigation. So always try to write with a subject, I mean it's like a passive voice. It's not with the active voice, just like a passive voice. Then you can write this, comma, she underwent the surgery. So actually the purpose paragraph we wrote already the surgery name, so there is no need for repetition here. So just simply you can just mention the surgery. Then how they managed the case. Her surgical site was managed with a daily dressing, and hydration status was maintained with the intravenous fluid therapy and blood transfusion. So here 2 or 3 sentences can be merged together, and we can make a one simple paragraph, or else there will be more crowd. We will feel it's like the letter is like a crowded. So it's like a simple sentences we can make with the merging of sentences, but should be relevant one. Okay, so one thing, it's like irrelevant data, something related to care management inside hospital, and something related to diversional therapy or musical therapy or something like that. Irrelevant data should not be merged together. So here everything is like a management, so we can merge it together. Then it's better you can use some connectors like thus, moreover, in addition, something like that, so which will make your letter somewhat attractive. And moreover, comma, she was commenced on antibiotics as well as analgesics. So here no need to write all the medication name because it's already finished. Her mobility was assisted with the pickup frame. So everything we have included here within these 3 sentences. So but when you are writing the body paragraph, it should be like a story. So you can see that first patient got admitted in the hospital, second one they did the investigation, third one they got the patient for surgery, and next one is post-operatively how they managed. So they managed with the daily dressing and IV fluid, blood transfusion, and they have administered antibiotic, analgesia, and later on the mobility was assisted with the pickup frame. So everything it's here, but what is the thing, it will happen for someone, they will write everything according to the case note. Sometime in the case note they have given related to the mobility first, then again with the blood transfusion, again antibiotic, again with the painkiller, then they will write about something related to the complication, something like that. So according to the case note we have to get the data, but don't write the letter according to the layout of the question paper. So it will be confused. All question papers will not be same, so you should not get confused. So when you are reading the task, carefully read the task, get the data, keep it in your mind. When you are writing the body paragraph, make it like a story. So just you can imagine that this patient got admitted in your hospital and how it can be managed from the emergency department until the ward or somewhere, then you can write it down. So this is the body paragraph. Next one we can go to the social history. So it's like known case. Only for the known case you should not write this paragraph, but for all other cases you have to write it down. So here Mrs Vivek is a widow and lives alone. She is interested in gardening, that's all. And regarding her medical history, she has hypertension and on tablet Rambril 5 mg daily. So the usual dose it was 10 mg, but currently she is on 5 mg daily. So that's all. So here you can write about the marital status, and lives with the family or alone or with the children, something like that, and their hobbies, their smoking and drinking habits. These everything it will comes in the social history. And regarding the medical history, here you have to write the medical history and surgical history. Medical history is like only 3 things you have to keep it in your mind. If the patient in the question paper you can see sometimes they will mention the year, then they will mention some disease condition. That means in that time patient had experienced this disease condition, but now currently nothing is there. But sometimes they may mention hypertension since 2011. That means from 2011 until now they have the problem, they have the problem. So here you have to write, if there is date, if the date is mentioned from 2011, patient has hypertension, means you have to write patient has had hypertension since 2011. So that is a format. And in this question paper, actually there is no date, there is no year mentioned for hypertension. Simply they wrote patient has the hypertension. So here you can write patient has, that means she has hypertension and on tablet Referral 5 mg daily. And surgical history same. If it is relevant, you have to write. Irrelevant, no need. That is mostly the students will get confusion in this paragraph. All surgical, the past surgical history, all medical history, no need to write in this paragraph. Only the relevant according to this present condition. If something is relevantly happened during the past, you can write, but it should be with the had. She had or he had, this one. So like that. Example, we are writing regarding one post-operative patient, but the patient had, the example in this patient, maybe patient had fall or fracture long before, maybe 2004, means you can mention patient had fracture in this area in 2004, something like that. One more thing I want to tell you, if you want to write the date, I mean the especially the year, it should be mentioned in 2004, in 2011, like that. Day or date you can mention with the on. Then the last paragraph is a recommendation paragraph. So now everything you can recall from your mind regarding the recommendation. And this recommendation paragraph also should be like a order wise. You have to give the priority for regarding the medications or surgical site dressing. These everything should be come first, and regarding the diet, exercise, this everything should be last, and all follow-ups maybe after 2 weeks, after 1 month, these everything should be the last. So here we can use many connectives. It would be appreciated if you could kindly, please, kindly note that, please note that, it is essential for her, it is important for her, it is vital for her. So these all connectives, you can use it for sentence construction. And everything should be like in a polite manner. We could not write just like patient should, like that. We should not tell, we should not write like that. Everything should be in a polite manner. So example, it would be appreciated if you could provide ongoing care for Mrs. Vivek as she requires daily surgical site dressing until complete removal of staples on her 10 post-operative day. So here one more thing, it would be appreciated if you could, it's acceptable. It would be greatly appreciated if you could, is already removed from OET. So please don't write that greatly. So it would be appreciated if you could provide. There we mentioned in the paragraph continued care. So here you can write ongoing care. So repetition maximum, please avoid the repetitions. So you can write like the synonymous. So Vivek as she requires daily surgical site dressing until complete removal of staples on her 10 post-operative day. Next one, kindly monitor her blood pressure twice daily and hemoglobin repeatedly, because during post-operative time she experienced hypotension. So we can write like that. It is essential for her to apply anti-embolic stockings for 2 weeks and assist her in daily living activities. So here we merged two recommendations togetherly. Then in addition, please assess her for rehabilitation therapy. So it's clear. I hope everything is clear. Within simple sentence we can write. So it is easy way. You can write with the please, kindly, please note that, kindly note that, this everything. It is easy to use. And this is common for all letters. If you have any queries, please do not hesitate to contact me. The winding up, yours faithfully, registered nurse. Here, faithfully and sincerely. Actually, the reader name is not given in this task, so you can write yours faithfully. And if the name is given, you can write yours sincerely. And the conclusion is like a registered nurse, or according to the case note, you can write the the position of. Sometimes they may give your name. This is your name, and in charge of this ward, something like that. If something like that means, you can write your in that mentioned name, and down you can write registered nurse. So I hope it's clear for you. It is like a simple letter, nothing complicated. So if you practice in this way, it will be very easy for you to write any type of OET letters. So the starting thing, it's very easy to remember, nothing but you have to copy from the question paper, and the salutation and regarding the patient. So here you will get confused while you are writing some question papers, but it's okay. When you practice more, gradually it will be easy for you. And a body paragraph should be like a story, and please write it like I write it in a passive voice maximum. And this is social and medical paragraph, only relevant data. And in the recommendation paragraph, just you can add all these connectives, so it will be easy for you. And this is the last sentence, and you can conclude here. So these are all the things you have to keep it in your mind while you are writing OET letter. So I hope everything is clear until now. And once if you go through this task, please write it down again when you are getting same case note. Just you can think inside your mind, in your mind, and try to write it down in a same manner. So if you feel if you are comfortable with this type of letter construction, please follow me. Okay, thank you.